Tulsa's crisis response team says mental health crisis calls are on the rise and they can barely keep up right now. News on 6's Ashlyn Brothers is live tonight with more. Ashlyn?
Well, Craig, right now the crisis response team can only provide mental health help Monday through Friday during regular business hours, but the need is much greater. The Tulsa Crisis Response Team includes a police officer, a Tulsa fire paramedic, and a licensed clinician.
This type of response is unique in nature. It's something we're seeing more and more.
The team says it's about having the right people at the right time with the right kind of care.
Police officer is usually the first one knocking on the door or making the approach because of the safety issue.
The officer could take someone into protective custody for a mental health evaluation.
We get disturbances. We get public nuisance complaints or people out yelling or screaming on the street. Sometimes there's been a crime that's occurred.
TPD also has 190 officers trained in crisis intervention.
Where we have a COPES clinician in our 911 center. So right away they're scanning calls and looking at ways to divert from law enforcement to the COPES clinicians.
They get about 1,000 mental health calls a month.
We do a lot of training in de-escalation, crisis intervention, assessment, rapidly engaging with individuals, and then connecting them to ongoing care.
Family and Children's Services says calls in February were up 21% from a year ago.
There were loss of jobs, new employment, child care issues, stress, depression, anxiety, just the unknown.
This body cam video from a mental health crisis in October shows there's a need.
We have like a crisis team, but they're busy right now.
There are only 3 or 4 people or whatever, so I mean, if they're busy on a call, what are you going to do?
And you can't be everywhere at one time, so you have to look at the high priority calls.
The team says it's rewarding when they can keep people out of jail, connect them to family, and get them the treatment they need. CRT says 988 is a national mental health crisis line developed so that people don't have to call 911, and they're hoping that that'll be implemented in July of this year. Live in Tulsa, Ashlyn Brothers, Oklahoma's Own, News on 6.